Okay, hello. Today we are going to talk about sorting out patients using the triage tag. This is what a typical triage tag looks like, and it's usually held by the medical personnel. Okay, if you as a student, you are in a place where there's an accident and you want to help sort out patients using the triage tag, you can use papers, colored papers like I have here, or colored pens. But usually I feel the colored pens would be easier because to give each paper or put them in places would be harder. Okay, these colors, what do these colors stand for? Here we have black. If black, it means the patient has died or is at the verge of dying. The patient is pulseless and the patient is not breathing. It's usually transferred to the morgue. Next, we have the red color. Red color, it means immediate, and the condition of the patient is life-threatening, and the patient cannot survive without immediate treatment. If treatment is given, the patient has chances of survival. In this case, the patient's respiratory rate is greater than 30, capillary refill time is greater than 2 seconds, no radial pulse, and the patient is unable to follow simple instructions or simple commands, and as such you have to treat the patient immediately or else the patient might die. Here we have yellow, and in the yellow the patient requires it's not as severe as the red, but the patient has a stable condition and the patient will require observation. You have to take care of this patient, but not as immediate as the red, but you have to observe the patient because the patient can go back to the red, so you have to act almost immediately after you treat the or make plans for the red patient. Next we have green. Green is also called the working wounded. Care is given after all red and yellow have been given care because their injuries might be minor. It can be a scratch that can be handled after all the critical conditions have been taken care of. And lastly, we have white. Whites are for minor injuries or no injuries that you must not necessarily use a doctor to take care of. Thank you. Okay, now how do you tag a patient with your pens? You could use the marker that you have and mark the patient's body with that color, or on the forehead or anywhere, or mark green. If you just have one color or the patient's skin color is not making the marker come out, you can just carry a color that is visible on the skin, and maybe for example yellow, green, and so on.